Hello, I'm John Grom, and welcome to our 222nd Right and Left Discussion Forum. We hold our televised discussions twice monthly to demonstrate the value of civil, productive, open-minded political dialogue. Today, our panel will discuss modern American healthcare. What kind of changes have we had, and why? Today's panel begins with Bryan Laubaugh, president of R&B Financial Services. Then Dr. Ronald Chamberlin, retired senior research chemist. Tom Finley, former vice president of human resources development at Rubbermaid Incorporated. And Patty Haskins, former member of the Wadsworth City Council and faculty of Wadsworth Senior High School. Bryan, what do you see as the major changes in our healthcare systems, and how do you feel about them?
Well, I think one of the major issues that I see is that the pharmaceutical industry has sort of taken over the medical side of this business we call, the medical industry. I read an article in a little flyer that I get from a college up in Michigan, and the author of the article had a very compelling argument. And that argument is that the pharmaceutical companies have now embedded themselves in the individuals that actually deliver those pharmaceuticals, and those are the doctors. They've taken over the research end of it through heavy contributions and grants and funding for colleges to basically, test the drugs to find out if they're actually effective. They're able to insert their own numbers. The pharmacy companies, they run studies and everything, and they can actually now use those numbers in their in so-called peer-reviewed studies that are coming out of universities, a clear conflict of interest. So there's really not a third party, a third disinterested party, to really review all the drugs that have been coming out of this, this pharmaceutical industry, and that's disturbing. The author points out that a fair amount of the drugs have very little increase in effectiveness. So let's say you're taking a drug for diabetes. A new one comes out, and your doctor prescribes the new one just because it's new and it has, better results and everything. But how much better is that drug? And in a fair amount of the instances, it's very little improvement. So then when because the doctor doesn't have time to do any research, the pharmaceutical salesman comes in, takes them all out to lunch or provides them some snacks and remembers everybody's birthday and everything, and has a new drug. And, the doctor wants to be on the leading edge of all this kind of stuff because there's all these advertisements out there and his patients are beginning to ask for it. So he does very little research, but when he does that research, he's reading what he thought was peer-reviewed studies on that drug, when in fact, those peer-reviewed studies are laden with data and research that's done by the pharmaceutical company, and that just doesn't set well with me. So another thing that I'd like to bring up, I listened to a podcast some time ago. Barry Weiss, who was with the New York Times, has a podcast that's called Honestly. And she interviewed a lady who was trained as a neurosurgeon. And shortly after she, went through her fellowship and everything, she decided after about a year of being a neurosurgeon that she really couldn't treat the patient for what they really suffered from. So she gave a little case. An individual, patient came in and was basically complaining of headaches. And they did MRIs and everything. And she was convinced that she had some sort of problem with her, with her brain or anything. And they did everything and there was nothing there. But as her neurosurgeon, she couldn't tell her that if she lost 60 pounds, got off some of the diabetes medication that she was on, and started to exercise, that her migraines and her headaches would probably go away, and that she should stop drinking, liters of pop every day. But she couldn't tell her that.
Why?
That's her doctor, because I guess the constraints that she was dealing with, she had to look at her brain.
And that's all.
And that's all. And she was chastised by some of her colleagues in this pretty prestigious neurosurgeon practice for trying to solve these other problems. And she says, well, what am I here for if I'm not here to heal the patient? And they're like, maybe you're in the wrong line of work. So that was so disturbing to her that she quit, and she started a whole health holistic clinic, wrote a book, and I have to get it for you. I don't have it here, but basically it's like physicians are not treating the whole person anymore. Their constraint is, what's that?
I remember that book.
Yeah, well, and I mean, she makes a very compelling argument that if you really want to be healthy, there are other things you can do other than, medication, more prescriptions. They don't talk about being healthy anymore. They don't talk, and she had many examples of patients that came in over that, her fellowship and working as a neurosurgeon. I mean, this lady was a bona fide, credentialed brain surgeon. And she's like, I'm not going to open up your skull when I can't find anything there. Here's some things you can do to get rid of those headaches. I can't prescribe you any more medication. Some of her clients were on 12 and 13 prescriptions that they took every day. And she says, that's just not healthy. So those are the things that I really struggle with when we start talking about our current healthcare system. We really need to focus on health care, not just a 10-minute review. Here's a prescription. You'll feel better tomorrow.
What are your thoughts, Ron?
Bryan, I think you're right on a lot of that. Certainly big pharma is a mixed bag. As having been in the scientific industry, I know how expensive that is. There are a lot more oh crap moments than there are eureka moments. So somebody has to pay for all that. Now, unfortunately, there's so much skullduggery going on there. Well, I thought I got interested in thinking about the Medicare system and the government obligations, the government activities in medicine. I know many of our viewers are not in Medicare age, and maybe really don't know how it's working, but it was signed into law by Lyndon Johnson in 1965, and there are two parts to it: Part A, Part B. Part A is hospitalization, and Part B is for medication. And prior to this, private insurance companies, everybody knew about Blue Cross and Blue Shield, and there were employer methods. I grew up with them, and in my working career with employer supplied plans, contributory. I paid so much, they paid so much, and different types of them, all sorts of things. So when I retired at 63. I had a couple of years to go for Medicare. So there's something called COBRA, which is a continuation of benefits activity, and you can keep the same plan at the same prices for a year and a half. So I did that. Coming up to the end of this, I still had 6 months or so to go. I contacted a friend of mine here in town in the insurance business, and he found a thing for me about 3 times what I'd been paying, but that's the cheapest he could find. I did that for a while until I got onto Medicare, which was much cheaper. So Medicare has been changed and improved over the years. And let's see, it was soon in 1972 they put in the Part C, which allowed various HMO organizations and so forth to get into the act and begin to do bidding for what they called Medicare gap programs, and then eventually a Medicare Advantage program, which allowed paid for some of the things that Medicare did not care. In 2003, I believe it was, there was the Part D put in, a pharmaceutical option where you could opt into that, and it's separate from an Advantage program. In 2000, where are my notes here? In 1997, they put in the CHIPS Act, which is a children's health insurance program, and that was intended to be for uninsured families who made too much to qualify for Medicare, and so that's something.
Medicaid, you mean?
Medicaid, yes. Excuse me. So that's continuing, and that's Medicaid programs in general are administered by states. So it depends on your state how well that's supported, and there's all the time thinking about should we cancel this? Should we cut it back? Should we improve it? So that goes on in the government. In 2010, the Affordable Care Act came in, and this allowed. Well, before this, to go back up a little bit here. Before this, as pharmaceutical companies got into this, when the other acts came in, they were allowed. The government would not interfere with negotiations between the pharmacies and the healthcare systems and the insurance companies and the doctors and so on. And none of that was allowed. This is probably, I think, about the rise of the very high cost of pharmaceuticals. Some of the things there. So the Affordable Care Act has made it possible to negotiate and has put a hard cap onto cost of prescription drugs, which is good news for us seniors, believe me. So I think this leads me thinking about my own experience here. Since being on Medicare, I have had a coronary artery transplant. I have had a heart valve placed. Both my wife and I had hip replacements, and we paid very little out of pocket beyond our monthly fees and our annual contribution out of our Social Security. It makes me think about the idea of universal health care, that this has been, by and large, administered, as I can see it in my experience, has been administered very well. Now, we have the problem of trying to figure out how to pay for the darn thing, as we do with Medicare, because as our population ages, we seniors are beginning to outpace the number of people in the working industry who are paying for all this, who are contributing into the trust fund, which we are drawing out of. So this is a problem that society will have to solve. But it seems to me, as a liberal, that this is a spot where where all of us have to support each other. That is, the government has to step in and use our funds to support our population in need. So beyond that, it's in my thinking of the current state of affairs. I know it's very expensive. Even the marketplaces that were set up in the Reform Acts here and the Affordable Care Act are work okay, but still people out there telling horror stories and paying very, very high amounts for their health care. Particularly in my case, when I retired and had to drop COBRA because of pre-existing conditions, my expenses were very high until Medicare kicked in. And even then, I went to change plans a couple of years back and could not get the first cheapest one that I found because of my pre-existing conditions. So there's all that. There's all those things to solve. But by and large, I think we need to start looking at universal health care from my point of view.
Okay. Tom, what are your thoughts?
I don't know about the the definition of universal health care. When I look at this from a big picture standpoint for just a moment, the most important resource any country has is the mental and physical health of its people. Now, if that is a true statement, if we agree, then the care of that, the establishment of the system, the leadership for that becomes one of the most important priorities of government, be it local or national or wherever. The most important ingredient in that is how does leadership emerge? Who takes this? What shape should we have for the departments, the units? Who in the government of the United States should have the responsibility for the quality of the healthcare system we have? Those are the questions I pose and put out. It's like, who's driving the boat? Who should be driving the boat in this country right now relative to the mental and physical health of our people? And I come up short with an answer to that.
It looks like we've frozen here.
You're fine. Keep going.
Okay. Tom, did you have additional comments to make, or did you just get frozen out?
I made my initial comment. I just took about 3 or 4 minutes. So didn't it?
Okay.
Did not record?
Yeah, I did. I wasn't sure you were done. Patty, what are your thoughts?
You're muted, Patty.
Bryan brings up the pharmacies, and he talks about old medicines and new medicines. Well, the one reason they push the new medicines is they can charge more for them, whether they're better or not. So many of the older medicines, which perhaps are perfectly good, they've lost the patent on, and they can produce generics of. And so it's much cheaper for people. Every time they bring out the nice new shiny formulary that's not covered many times by many insurance plans, they can charge top dollar for that. One of my big problem with pharmacies is just simply the cost of those medications. And why can you purchase drugs in Canada so much cheaper than you can in the United States, or actually in any other country? And I know that the present administration is working on ways to negotiate those prices and to bring them down. And hopefully we can do more of that. Ron brings up the healthcare system itself and the fact that we might need to go to some type of universal health care. I think the ACA was a good start for that. Obviously, a lot more can be done. One of the things that did was to advance the number of patients that can be on Medicaid, because there is a great need for that. Unfortunately, at this time, there are many states that are stripping families from Medicaid coverage, which could have a definite influence on the health of our country. We need to be able to provide health care for everyone. I consider that a right that we have. And, whether it be by paying what you can afford or simply providing it, something needs to be done to maintain that coverage for the citizens of our country. As even Tom has said, the problem seems very clear. It's just, how are you going to deal with it? And how can you come up with the amount of money, as Ron said, that is needed to pay for that kind of system? One of the big changes I've seen in medical treatment is the advancement of technology. It has, with the use of AI, they have taken so many procedures which were done by physicians, and it's now basically being done by a machine. And so you have a different type of person that needs to deal with that type, with the AI equipment. I mean, who does the surgery? Is it the surgeon, or is it the person that's the best machinist? and can handle the equipment. Just going to the doctors now, you don't get test results just by calling and saying, hey, what was my blood pressure? What was my cholesterol count? You have to go online and create a pass number and access data in order to find it. I know for me, who's rather technology troubled in many ways, I have a lot of difficulty with it. And I'm sure there are others that do as well, that have difficulty in using all of the technology that is necessary to actually obtain the results you need from your latest doctor's report. The use of AI within the medical field itself, though, can be troublesome. Are we getting away from that personal touch that the doctor would provide? That, going back to what was said earlier, that from Bryan, getting that whole treatment, that holistic treatment by the doctor, being able to treat the entire person and do what's best for them, is now being managed by a machine that tells you what to do and when to do it.
Okay, I make this observation. My overall observation about the healthcare system is that it costs us in this country twice as much as it does other people in other developed countries. We're paying about $12,000 per capita per year, and other developed countries it's more like $6,000. And for that, we have a declining life expectancy. I don't know the reasons for that, and I'm wondering seriously if universal health care is going to make an improvement in all that.
I have a comment on that. Happened to hear a podcast just yesterday, and the person was talking about a new class of drugs that has just come out. This particular one works on appetite, but it's not just a typical appetite suppressant, which just sort of ramps you up, which high caffeine or whatnot. It's a system that mimics the body's own procedure for this, so that what happens is that just generally you just don't want to eat quite so much. And he points out that one of the major causes of all the ills that we have is obesity. This country is very high. There are other countries that are just as high, like Saudi Arabia, for example. People are getting fat. What does that do? That influences cardiovascular health. That influences diabetic health. I don't consider myself as overly fat, but technically by the body mass index, I'm obese. I'm like 25 and a half or something like that. So, I need to be a 10-foot tall oak tree just to sort it all out. But so his comment was that this drug is now very expensive, of course, as it's just new. And as it begins to become popular and begins to be used, the price will come down. He estimates that within 10 years in this country, and he's a man who, he says, I'm just a monkey with a microphone, but he does a lot of reading. He gets into the original literature. He has conversations with people in the medical research field and so forth. So he backs up his stuff with a lot of facts as well, and then speculates off the basis of those. He says he believes that within 10 years in this country, the obesity crisis is going to turn around, and these reasons we have this are one of the reasons. Well, first of all, that our life expectancy is decreasing a little bit. Our birth rates are decreasing. In developed countries, this is generally true, because as people move out of their agrarian lifestyle, where we're living in a world, in a universe which we are not evolved to live in. We're evolved not to eat this much food. We're evolved it's very scarce in our evolutionary history. Food was scarce. We went out and killed a buffalo. We had to sit down and gorge ourselves and eat, make that last as long as it could, but it wasn't there all the time. So we were frequently hungry. When we lived on the farm, we had to make lots of babies because we needed farm hands. That's not true now. And our bodies are not adapted to that. And so there's a lot of food. Somebody once said, I'm on the seafood diet. I see food and I eat it. And that's pretty much one of our problems. And Brian, I have an example of this business of the doctors prescribing what's brand new. I was on a drug which went generic. So my doctor, he says, oh, let's try this new one here, which is a bit more expensive. I says, hey, doc, I'm taking this other one, the same dosage. Why don't I just keep taking that? He says, oh, okay. I guess that'll be all right. So,
Yeah.
so that was.
You mentioned obesity, and the sad thing is cultural norms now are saying that it's okay to be overweight. Not a good idea.
Exactly.
One of the
I
issues.
would just like to, I'm sorry.
Oh, no, go ahead, Tom.
I'd just like to go back again to looking at big picture and the country and its resources. And that big picture says, if we do not have a system and leadership of that system, we'll have chaos. We'll have hit, skip, and a miss. This one is so important because the most important resource we have as a country is the people. I don't see any signs of management leadership for the healthcare system going anywhere in the country, be it with our federal or state or local. I just don't see it. No one is moving forward to look at how we put the management of this system in the right places to get the resources needed to help our people and
Big
keep.
pharma then fills that gap, don't they, Brian?
Well, they're providing the leadership. That's the problem.
Yeah.
There are leaders, and the leaders are coming from the pharmacy industry, and they're saying, doc, we've got a better drug for you to use, and we really would like you to use it.
Yeah.
And the unfortunate thing is your primary care physician used to be that holistic physician that when you came in, they would say, you know what, you gained 10 pounds, you're starting to do this, that, and the other. Here's what you need to do. What they're doing is they're saying, you've got a headache, I'm going to send you over to this specialist. You got a backache, I'm going to send you over to this guy over here. And they're almost constrained from telling you, or, Ron, if you think you're obese, I'm off the charts when you look at BMI. I mean, I don't think I've ever weighed what the BMI table says I'm supposed to weigh.
Yeah.
I did when I was 12.
Exactly.
Yeah, maybe when I was 12 or 13. I was always the husky little kid. Remember the Huskies when you went to get jeans at Sears? Your mom said, "Oh, you wear a Husky." But what people are looking for is that quick fix.
Yeah.
Now I'm all for the pharmacies and doing better and advancements. I'm not sure. Now, I've had 2 back operations where the doctor used some pretty advanced stuff. I don't believe it was a robot. It was some sort of a device. It was microsurgery. So he looked through like a microscope and went in there. But I really think we have to look at the whole person anymore.
Yes,
we're
going to have to do that some other time.
Okay.
Because we've just exhausted the clock. Thank you very much, folks.
Yeah,
we'll see you in 2 weeks.
Okay.
2 weeks from
Bye.
Thursday. Yeah.
Wadsworth Community Television.